Hey, Virginia. All right. Good afternoon, everybody. We have made it through one more day, which means we are one day closer to defeating this coronavirus. Sure, we don't know the exact day that will be, but we know that every day that goes by is one that we are closer to that light at the end of the tunnel. And I know we're strong enough to keep marching towards it. I know we can take anything that this world throws at us, and I know that we are going to do what it takes to protect one another. So let's say it and mean it, that we will get through this, and we will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. We're going to get through this together because we're strong enough, we're resilient enough, and at the end of the day, we're going to make good decisions. At different times, we're going to be tempted. We're at the beginning of summer, and we all want it to be a normal summer, but we don't get a normal summer in the midst of a worldwide health pandemic. We have to realize that our world has changed until we get that vaccine, and that we've got to continue to treat it as change, to protect one another, to do what it takes, and to ultimately come out of this having passed the test that's been put in front of us. So a lot of generations are tested, and a lot of them fail in different ways. I want this generation to be one that passes, that goes down in the history books as doing what it took, as coming out on top, and as being a really special group that came together in a time, even when there was political discord, even during a time where some might not have believed in how difficult and deadly this virus can be. But we here in Kentucky understood that protecting one another is part of our calling, part of our faith, part of who we are. It is in our DNA as Kentuckians. So we're going to get through this together because we're going to follow the 10 rules to defeat COVID-19. All right, so today we are going to just briefly focus on crowds and gatherings. So we've been healthy at home, which means there have been no crowds or gatherings. Now that we're healthy at work on day 2, there's going to be more opportunity there. It could be people who haven't seen each other in a while wanting to all crowd around in an office. It could be wanting to have a waiting room somewhere or be in there even though you're not supposed to because of not having talked with other people in far too long. It is still really important. Remember, our reopening of our economy is tenuous, right? It's fragile. It can be upended by a spike in cases at any time, and that's true all across the United States, not just here. So we got to be really careful. We got to be really careful that we're healthy at home, we're healthy at work, and then we're back to being healthy at home. And everything from life before that we want to add on top of that, and add on top of that, and add on top of that, threatens more contacts, more cases, and ultimately could upend our reopening. So if you are a person, like all of us, that want to restart our economy and want it to be successful, that want us to climb out of what we're in, it means we've got to avoid crowds and gatherings. We've got to avoid the temptation for this summer to be like past summers and for us to do the different things that would bring whole lots of people together. Because if we do that and it shuts down our economy again, then we have failed in the undertaking that we are working on right now, which is healthy at work. Our health and our economy have to be our 2 major priorities. We can get that done. All right, so we have the 10 rules plus 1. Fill out your census. We're now squarely in 14th place, I believe. We can do better than that. Just a couple percent moves us ahead. These are federal dollars, and listen, we need federal dollars. Every single state is pushing Congress to provide direct relief to states and to localities to make sure we don't make any recession or any pause of our economy any worse. These are dollars that are coming no matter what, if and only if you fill out your census. Every person that fills out the census, it results in federal dollars coming our way. So please, if you want our economic opening to be successful, if you want our recovery from COVID-19 to be successful, we need you to fill out your census. In addition to the 10 rules in the census, especially now that we are taking on even more responsibility, we ask you to model the important behavior that we need to see to all be healthy in what we are doing around this Commonwealth each and every day. Let's briefly go through and see what we have today. Graduations. Graduations are important times, whether it's elementary, middle, high school, college, you choose. And we're seeing folks find really special ways to celebrate it. And maybe what it reminds us of is it's not the actual graduation ceremony, it's the accomplishment itself. And maybe when we focus too much on whether or not we're all going to be able to get together for that graduation ceremony, we shortchange what our kids or our friends or our classmates have done, that they have risen to that level, that they have passed another threshold, that they have done they've achieved a real accomplishment. And my hope is if we focus on that and the good job that they have all done, including my son who's graduating from 5th grade this year, like this young man, that we can convey how special it is and make it a great day for them. All right, so this is again one of our great principles, planning for our end of the year. I know that there are some complications. We're working through it. We're going to make sure that our kiddos get the NTI, the distance learning that they need, and then we're going to do everything that we can, everything to be ready to go back to school and to get as much in classroom learning as possible. When folks want to ask about how we stage the timing of what we're doing, it's all aimed at trying to have kids back in class in the fall. That's what we're working towards. We do things too fast, we have to pause. That might not happen. And so we do too many other things other than healthy at home or healthy at work. This might not happen. So again, let's make sure that we're committed and that we realize the extracurriculars we're probably not going to be able to do in the short term, but that's because we want John to get back to seeing his students in person. All right, these are our postal workers. You know, we've talked about a whole lot of our essential workers who are out there doing things that never shut down. We didn't talk about our postal workers enough. And look at them, doing what it takes, wearing their mask, knowing that while it might not protect them from getting the coronavirus, it protects other people if they are asymptomatic. Just a small part of our test of humanity. Are we willing to do something uncomfortable? Something that maybe we don't think we should have to do if it protects the people around us. And it's a question if somebody is not doing this, if they're asymptomatic and they spread it, can they live with themselves? If it harms somebody else, can they live with themselves? I know I couldn't, and that's why I choose to do this. And also with, and we'll talk in a minute now, 2 kids suffering from this COVID-related illness. I don't know if this keeps me from getting it and bringing it home to my family. I think it does. It provides at least some barrier of protection. But even if it's just a small percentage, I'm going to do it because I love my kids more than anything else in the universe. I'm going to do everything I can not to bring this virus home. All right. This is an AP class meeting via Zoom. And showing again that there is still that opportunity for learning for AP type classes, which is certainly higher level learning, and knowing that there is a big bright future for these students ahead. And finally, this is pretty neat. This is WKU in Bowling Green. Bowling Green, of course, seeing a really significant outbreak, one of the fastest growing outbreaks in the country. Masks have been made and left right here on Cherry Hall. I remember Cherry Hall actually announced I was running for governor in our tour right there at this facility. Pretty special place. Now, the favorite videos we ever show are the positive stories of recovery. This is a scary virus. It's still taking people from us. And every time somebody recovers, it ought to be a celebration. Now, this is the same facility that we have shown another recovery from. So you may recognize a little bit of this, but it means another person has come through their battle and one that struggled to get through it. So, for the first time today, we've shown more than one person recovered in a video. If my count was right, we were at 6, and that's pretty incredible. Hope it gives everybody out there hope. Hope that there is a day where we will all have beaten COVID-19. This is going to be something that is burned on our psyches, our memories. It'll probably change a little bit how we interact and in our world going forward, but I want the day where we all feel that personally, and until we're there, I want us to celebrate with each and every person that has moved through it. So again, parents, if you got younger kids watching, let me give you just about 30 seconds to find something else for them to do. We have just some similar news as yesterday, and I didn't give you the heads up, so we'll take just a second. All right, if you haven't gotten that done, pause the TV because I'm gonna move ahead. So today we've been advised of a second minor that is suffering from COVID-related illness, not in as bad of shape as our 10-year-old. That we're told that the 10-year-old is doing just a bit better, but still, is fighting. So I wanted to ask Dr. Stack, given just the seriousness of all of this, and it being something new that we're seeing, to talk about this second patient.
Thank you, Governor. So we now are aware of 2 patients in Kentucky. One is the 10-year-old who is critically ill in the intensive care unit with what we're describing now, or the terminology being used, is a pediatric multi-system inflammatory syndrome. And this was first reported out in New York, to my knowledge. The 10-year-old is showing signs of improvement and has had some of the medications reduced, which is a good sign, meaning that their body is showing signs of recovery. And so, again, our heart goes out to the young child and their family. The second patient is 16 years old and is doing well and is in a regular medical bed and was admitted to the hospital out in abundance of caution so they could be monitored closely, and should there be any signs of progression or deterioration, be in a place where they could have care implemented promptly. I would like to share just a little bit. I didn't have this for yesterday, but the reports have been that this is similar to Kawasaki syndrome in some ways. It's an inflammatory process that can involve multiple organs. The children who get sick with this can have cardiovascular collapse and require supportive measures to maintain their blood pressure, respiratory collapse requiring breathing support with a mechanical ventilator, and endure other problems. And so it's a very serious condition. As always, I try to frame these and put this in context. For these individuals who have this, this is very dangerous and life-threatening. Though as far as we're aware, the early reports are there have not been deaths from it yet, but some have clearly come very close. There's a lot we don't know about this disease. It is an inflammatory process that develops in a delayed manner. And so one of the things that we keep emphasizing is this disease has only been known in the human population for 4 to 5 months now at most. And we're going to continue to learn more. So if I may, there were 2 other points I would share related to this. We don't know, again, for sure, but early reports suggest that warm weather may not help us with this. So early reports are beginning to show that your latitude and longitude, or where you are on the planet, whether you're in a hot place or a colder place, may not help us. And so we're hoping that we were going to have some diminishment of the disease in the summer months like influenza. Early signs are that we may not be able to have that benefit. So we will have to see. But when we tell you to maintain your caution and social distancing and universal masking and good hygiene, those are all very important. I'd like to share one other thing. Just today, the Centers for Disease Control released an MMWR, which is one of their morbidity and mortality weekly reports. And in this report, when we talk about wearing these masks and why it's so important, I'll just read this one little paragraph about what they say we learned from this report. That following a 2.5-hour choir practice attended by 61 persons, including a symptomatic index patient, 32 confirmed and 20 probable secondary COVID-19 cases occurred. 3 patients were hospitalized and 2 died. The transmission was likely facilitated by close proximity within 6 feet during practice and augmented by the act of singing. So this is the graphic. So this came out today from the Centers for Disease Control, which is the national body that is recognized as the expert for these conditions. And they show the one person that was known to have the disease could have spread in 1 2.5-hour choir practice this disease to 87% of the people that they were in contact with. So again, I say this repeatedly. I try not to be sensational about these things. This is a serious disease, and it spreads very easy. And while the statistics are good for children, that most are going to be perfectly fine, the statistics are not perfect. And that for some of the young people, and we have 2 of them in the state right now that we're aware of, and for others in New York who had to be on ventilators and medicines to keep their blood pressure up, and clearly for those who are in confined populations and nursing homes, this is a very, very dangerous disease. And so I continue to urge you to stay not only healthy at home when you're able, but certainly healthy at work now that we're trying to respond to society's needs to return to some kinds of activities that have been off limits for a while. So thank you very much, Governor.
Thank you. So keeping this up for just a minute, if you wanted to know why we worked so hard to get specific guidance out for not just churches, which this CDC example comes from, but businesses and other activities, this is the reason. That very specific guidance based on what we have learned thus far from the spread of this disease helps us stop it from spreading in similar circumstances. Right? If we've learned about the disease and how it can spread in a circumstance, we shouldn't repeat it. And that should be pretty simple. That if we know that there is a way or a circumstance or an example that makes it even more not contagious, but helps the spread more than others, then we've got to be very careful about it. So I got to say I'm really proud of the houses of worship and the organizations that we've worked with, wanting to get it right, wanting to make sure that their sanctuaries are truly sanctuaries. When this example from the CDC, this isn't us in Kentucky, this is Center for Disease Control, is showing what a group choir can do. And so this is one of the reasons that our guidance talks about not having choir seated like this, and then just in church, being really careful about singing with folks around you, and of course the safest way being to use this. This isn't anybody trying to take away anybody's liberty. It's trying to keep one person from infecting the next 32 in just one time that they could be singing. Now, This could be any other place of business. It could be a concert. Question is, well, what about big plays or musicals? It could be there. It's any of these types of activities, and just how quickly it can spread. And this can apply to some of the things for the summer. I know there's a group that really wants to open big kids activities, public pools. This could apply just as easily to that. Put this number of kids in a pool, knowing that they're going to get together, and look at how quickly it can spread. It's not trying to limit things, it's just science and public health and trying to protect people. Anything right now that we're saying that it's not safe to do, it's not because we don't want people not doing it. I want people to do anything that's safe. It's that I can't tell you that something is safe when it's not. And at the end of the day, I think it's my job and it's Dr. Stack's job to do our very best to tell people what is currently safe and what is not in the midst of a worldwide health pandemic. And I'm willing to take any disagreement, any criticism. At the end of the day, if my time here is about making the right but the tough decisions, then make sure that your kids and your friends and your parents and your grandparents are all with us the month after everybody has ultimately been vaccinated, and that's fully worth it to me. All right, let's go over our numbers for the day. So every Tuesday, if you all have been following, is a little bit higher because numbers come in over the weekend. But I tell you what, today they are lower than they've been in the last several Tuesdays, and that's a good sign. Again, suggesting that there is a plateau even with more testing, which is, again, a very positive sign. But it doesn't mean the virus is gone. It just means we're really good at following the rules and dealing with it, which gives me confidence for Healthy at Work. So today's number of new cases is 191, which leads us to a total after duplicates and out-of-state folks removed of 6,853, 6,853. 25 of those are probable. The rest are lab confirmed. Those come out of a total number of tests of 110,609. Our numbers are shooting up on testing, and I think we will see even more. I think we're very quickly surpassing a number of other states that were around where we've been, and I think we'll even have better news in days to come. Our challenge is not going to be capacity. It's going to be getting each and every one of you out there to go and to get tested, and you should. You should, because you should know if you're exposing your family or your coworkers or the rest. We need you to get tested. Ever hospitalized, 1,825. Currently, 379. Ever in the ICU, 783. Currently, 215. That number's going down a little bit, and that's a good thing. Recovered, 2,546. We saw 6 of those today on that video. So on those we've lost, we talk about people being more than a number. On those that have recovered, they're more than a number too. So I hope in your mind right now, you're seeing 2,546 people going through that same celebration, even if they didn't have as hard of a time going through it. Of new cases from today's numbers, 71 from Warren County. We hope to have some more information soon about helping with some more testing in Warren County. It's a serious situation. We want to be as supportive as we can. Good local leaders working through it. We are with you. Warren County, Bowling Green, and the entire surrounding community. Jefferson, 26. Fayette, 17. Logan, 12. Kenton, 8. Boone, 6. Boyd and Davis and Oldham, 4. Bullitt, Callaway, and Pike, 3. Barron, Campbell, Hardin, Jessamine, Montgomery, and Shelby, 2. Allen, Anderson, Bath, Carter, Franklin, Garrett, Grayson, Hart, Livingston, Madison, McCracken, Mercer, Metcalf, Muhlenberg, Ohio, Pulaski, Scott, and Woodford all have one. Virginia let me know that she lost a nail once that I was reading so fast that I'm working on it. I'm teachable. Speaking of that, we'll do the sign language here in a minute. But again, wanted to make sure as we've gone through this that we realize that this is really hitting people in terms of cases of all ages. Tomorrow I'm going to show the breakdown, which is on the website, of both cases and of deaths by age. But today we got a lot of young people from Warren County, including a 5-year-old, a 7-year-old, 2 8-year-olds. We have a 6-year-old from Kenton. We have a 7-year-old and a 2-year-old from Warren. We have a 4-year-old from Warren as well. So we want to keep everybody and anybody from getting this. But knowing, just like the CDC chart that we put up, this doesn't just apply, to people in their 70s and 80s. This passes to children just as much, though they appear to be more resilient. But again, being able to continue to spread it to parents, to grandparents, and to others, we ought to be mindful. We ought to be really mindful of how this is spreading and to whom it can spread. Not have a false sense of security, because while it is much deadlier to older Kentuckians aren't getting it at a higher rate than anybody else, and it can just hit you the wrong way. And ultimately, as we saw with a great man we lost in Ashland early on, one of our bricklayers, this can ultimately defeat you even if you don't have some pre-existing conditions. All right, well, the number of cases compared to other Tuesdays is lower. Our total number of deaths today are 10. And that's higher than we've had in a number of days. And while that's lower than many of our neighbors read off on a given day, that is far too many Kentuckians to lose today or any day to something like this. Each one is more than a name, than a county and an age. And I hope that we can share some of their stories if their families are willing going forward, because I know that these are special folks. It's a 74-year-old female from Boone that we lost, a 57-year-old female from Jefferson that we lost, an 85-year-old male from Jefferson that we lost. We have an 89-year-old female, a 91-year-old female, and another 91-year-old female from Kenton that we lost. We have an 85-year-old male from Kenton that we lost, a 59-year-old male from Fayette that we lost, a 77-year-old female from Jefferson that we lost, and an 85-year-old female from Hopkins that we lost. 10 families hurting today. We'll be hurting in the weeks to come. We'll have more challenges to their grief because of not wanting to further spread the virus. They need your love. They need your compassion. So I'd ask, light your homes up green. For all of you that are going back and being healthy at work, take the time to install some of those green lights wherever that work is, to light up as you're leaving in the night. As we continue to work through this, we're going to continue to lose some more people. Let's make sure that we don't ever let our compassion down, just like we don't let our guard down. Let's ring our bells at 10 a.m. Tomorrow. Brings our total number of people lost to 321 in Kentucky. I know models said we'd lose, some early models said we'd lose up to 80,000 people in Kentucky. And we know that's not going to happen, but it hurts to lose 321 people to this. So let's remember that it's real. Let's remember that it's taken people from us, said and made up. It's a lot worse and a lot more deadly than the flu. Let's push aside all that misinformation and maybe even intentional misinformation. Let's push aside the naysayers or those who say we should sacrifice certain folks. I don't believe that. I believe every Kentuckian has value. I believe every Kentuckian counts. I mourn for these 320 people and 21, and I'm going to do everything I can to make sure we don't unnecessarily lose people going forward. That's where I stand. So I'm going to do everything I can to safely reopen this economy. but I stand with trying to save lives each and every day. That's my bottom line. Ethnicity and race, the way it breaks down. On overall cases, 73.7% white, 14.6% black or African American, 6.31% Asian, 5.25% multiracial. And then on ethnicity, it's about 87% non-Hispanic and 13% Hispanic. On deaths, this had creeped down a little bit. I think it's creeping back up, and it was disproportionate from the start, but looks like it's going up a little. 77.7% white, 19.16% black or African American, and remember that's more than double, the percentage of the population, more than double. Not acceptable. It's based on hundreds of years of inequality, but inequality in our healthcare system that's got to end. Not okay. Doesn't matter how many times that I read the numbers, it's still not okay. And I hope coming out of this that we do a lot of things better and we do a lot of things different, and this one has to be at the top of our list. 2.1% Asian, 1% multiracial. Long-term care facilities. Again, this is one of the toughest areas, though the numbers were escalating significantly more in the past weeks. We have 12 new residents, 6 new staff, 4 new deaths, all residents, 2 more facilities. But with the testing we are now doing and significantly more testing, not seeing these numbers jump more than they have at this point gives me at least hope that while we will see more, because in confined communities, this happens with people in this age group. It unfortunately spreads really fast. It at least feels like we are getting better control in these facilities. And if numbers jump, but especially our death rate does not, it will mean that we are being even more proactive. We're going to get everybody tested in these facilities. And to dispel some other misinformation, we've always put a priority on these facilities. And for those that say, why are we only now testing every facility? If you go back 2 months ago, we didn't have many tests, and no one across America did. So we can't rewrite history going backwards to give us more tests earlier. What we can do is make the best decisions now that we have the capacity to do everything we can to protect folks in these facilities. We're going to have, as we move forward, a number of positive testing announcements as we move forward. I think that while we have, can you put the overall locations up? While we have more locations than ever, I think we had 50 last week. I think we have around the same this week. And you got to go to our website because different ones have different ways of signing up. But look at this state. It means there is a testing location close to everybody. And that is such a change. This is part of our new normal until this thing is gone. So let's make sure we take advantage. Now, I do want to talk about one new testing location. Walmart has opened up its second site in Kentucky. It's been in Louisville at Bashford Manor. It's now opening a facility in Bardstown. Again, you have to register. Its first day is Friday, May 15th. City of Bardstown, Mayor Dick Heaton reached out, said this was very important to his community, and I know he's working really hard there. And it actually, on their own dime, had some testing that was going, but this, I hope, responds to that community need. I will tell you, we are in talks with Walmart where we hope this partnership will continue to expand. It'll be a real positive in Kentucky. We all know in Kentucky we love our Walmarts and so many other locations. I think this is them giving back and helping out. Very quickly, our Kroger drive-through locations are really booking up in most places, but Corbin, especially Wednesday and Thursday, we have a lot of spots left. I know that this is an area where we have needed more testing. It's an area that would like to open up. The only way we know when we're opening up, when we're doing healthy at work, that it's safe is if enough people in the area get tested. So to all the local leaders there, please help us, and I know you are. I know you are, but continue to push people. This will give us a pretty good idea over the 3 days, Tuesday, Wednesday, Thursday, about the asymptomatic rate in the community, meaning how many people that don't show symptoms that have it, because that tells us a lot about how safe something is or is not. All right, so with that, we will turn it over to questions. We have 4 journalists that are here. We have Sarah Ladd, welcome. We've got Monica Harkins, who's in the, that's what I thought, but everybody's wearing their mask. We got Phil Pendleton, and I'm proud of y'all for wearing your mask. We got Catherine Collins. I have written questions, and we'll start with Catherine today.
Sure. Can you give an update on contact tracing and how many people have been hired?
The question is the update on contact tracing and how many people have been hired. We're doing direct hiring to increase DPH, our State Department of Public Health. Our goal there is to hit 20, and I know that is in process. We're doing regional hirings to assist the regional epidemiologists and give them a few more investigators. That's ongoing on a regional basis. We have the responses to the RFP, which will be the majority in. It gives us the option to hire even regionally through private groups, so that is all coming together this week. The thing we're trying to balance out is the who and the where. But I feel very comfortable that we will be in a position next week, probably the end of next week, to have our general apparatus around us, which is what we need. Our goal has always been 2 weeks from the 11th, which is really we will see the impact 2 weeks from that. And I want to say to our local health departments, this is in conjunction to work with you. You do amazing work. We're going to need you to continue to do amazing work. You are appreciated, and we're going to work really hard to integrate this with what you already do. We actually hope to have an announcement about some additional help that we're going to bring in there here later this week. Several local and national reporters have asked for more information on the 10-year-old on the ventilator. Yeah, he is still on a ventilator, but he is improving. There are different indications that are there that he is improving. They at least are hopeful that they will be able to take him off that ventilator in days to come. But understand that somebody on a ventilator is in a tough, critical situation, and so let's continue to think about them. Unfortunately, we now have a second minor who is a 16-year-old that's hospitalized but doesn't require a ventilator, and we hope won't get to that point. So we start with Catherine. Monica?
Off of Katie's question, we've heard reports that people that have tested positive for COVID-19 are supposed to call their contacts themselves. So going off of that, wouldn't the health department want to do their contact tracing too? And can you comment on if they're still doing that?
So the system that we are setting up for contact tracing, which is really important. I mean, to do all this safely, we need 3 things. We need the right rules and practices, the CDC guidelines in place for our businesses as we go back to be healthy at work. And then we need testing, and we've got the capacity. Our challenge is to get the people tested. So those are our first 2 challenges. And the third is contact tracing, which needs to be done by an individual working with us, either directly for us or with the local health department, because we got to track all of that. And what we have is we have a tool now, and it's not a web, a system that we're going to demo for you this week that will show how all that information is put in. It helps us follow up with people on a regular basis. In fact, those that are feeling good, that are just self-quarantining, may be able to text in how they feel on any given day. Our goal is to reduce the amount of work if we have a big outbreak, but also reduce the intrusion on people if they're doing okay. So we're going to have a lot of opportunity there digitally, but no, it should be conducted as we move forward with trained individuals. Now, that training is going to vary based on where they are in the group, right? There's the investigator, which local health departments are very good at doing, about talking to the person, about who are your contacts, what are they, how much exposure have you had. And then we're going to have help to follow up with those folks, to tell them what they're dealing with, to tell them what we need from them. But in this new normal, part of our duty is going to be, if we get one of those calls that says, it's been really great to be going back into the office, into the factory, into the facility, but guess what? You've been in contact with someone who is positive. Now you got to self-quarantine under these guidelines. We've got to do it. Otherwise, it's not safe. Now, the COVID positive person in Louisville that went to Kroger, I think, twice. I mean, we can't let that happen. That ruins being healthy at work. We do too many things beyond healthy at work. We ruin healthy at work. So our economy's on the line here. We got to do all this right. People continue to ask for more guidance about the timing for reopening commercial swimming pools, water slides, and water parks. My hope is for exercise, lap swimming, and if we can do it right, swim teams, that we're able to do this. But can you show the CDC slide again? I mean, folks, I grew up going to pools. My kids, I'm going to want to get in activities as soon as possible. But this isn't just a choir. This can be kids in the pool, too. And just because, and I know a lot of people want them open because they feel like it's a part of the summer, doesn't mean it's safe. And I can't stand up here and tell you something's safe just because you really want it to be, or just because I really want it to be. It's not trying to steal anybody's summer. The coronavirus is doing that for us. It's trying to keep you safe and protected, trying to keep your kids from spreading this to other people. I mean, none of our kids want to have to grow up knowing that maybe going to see a grandparent when they've gone to a pool is the reason they're not here anymore. That's all very real. That's not fear. That's very real in how this works. And so just one person, in a big public or commercial pool, of kids hanging out, swimming, playing basketball, or the rest can cause this. And if we were to look at plans on reopening, I mean, there's some out there that it's one person per every 100 square feet. How many people can you fit in a pool like that? And is that possible with kids? So a big challenge. Again, it's not wanting to keep people from doing things. It's just that we know there's a very aggressive virus that spreads out there.
So there's a new lawsuit from 4 protesters who came to a May 2nd rally, and they're basically arguing that they don't feel like there's due process and a way for them to legally protest different rules about mass gatherings. And so have you seen it? What's your response to that?
Yeah, so there's a new lawsuit about people who came and protested that don't think that they can come and protest, even though no one's done anything about when they came and protested. In the midst of this pandemic, the people who are bringing this lawsuit participated in a rally where the speaker said, "Take off your mask. You don't need to socially distance," and put people at risk. So I want people to be able to speak out. I want them to be able to disagree with me. I want them to be able to protest, but I want them to do it safely, that's all. Safely. And even when they did it in a way that wasn't safe, you haven't seen any type of repercussion. But if you're a leader organizing that rally, shouldn't you want the people that are there to be safe? If you're the one leading the rally, they're people that agree with you, that you're trying to marshal towards your cause. Shouldn't you want them to not be spreading this virus? My concern is so many people who are leading these rallies don't believe this thing is real. Otherwise, they'd say, everybody stand 6 feet apart, going back. We're going to mark off different places for people to stand. Everybody wear your mask. Make sure you're doing it. And I'm going to wear a mask at the rally until I speak. Let's just take care of each other, even when we're disagreeing. And I know people are going to say I'm trying to stop people from disagreeing with me. Listen, I've had people disagreeing with me my entire political life. And, well, hey, I grew up with an older brother my entire life. I just want to make sure that people are safe going through this, and everybody matters, everybody counts, and let's make sure that everybody is still here to disagree even after this is done. Now, I do not think it's okay to be waving Confederate flags during a rally. Now, I guess you can do that. It's your right of free speech, but it's really wrong, and it sends a message of hate to too many people that are out there. I don't think it's right to be showing white supremacy signs, here on the Capitol grounds. Now, that might be free speech, but I think it sends the wrong message. It's a message of hate, and I believe in a Kentucky that includes everyone and respects everyone. All right. Tom Latek tried to get some over-the-counter medicine with his card, but his driver's license is expired due to the virus, and the DMV was closed. How are we going to help? Oh, no, this is from one of his readers. This would have been better if this was Tom himself. So we have, through an executive order, extended everybody's driver's license. That expiration date shouldn't be used as a reason that you cannot get your over-the-counter medicine. So we will communicate with pharmacists across the state about that because you cannot get it right now unless there's a mail-in option renewed. That's something that we'll do. Tom, I'm sorry I was saying that it was you directly, but it would have made a good story. Phil.
Has there been any new guidance as far as when libraries, public libraries, going to be able to reopen?
Yeah, we are behind on some type of government or quasi-governmental groups like libraries. We're working really hard on that. We want to make sure that they can do it in a safe way, and also to get guidance, because libraries can be really different in how their setup is and what type of options they provide. Some have courtyards and outdoor type seating. We want to make sure that we really think through the cleaning of the books and what we do, how long they'd sit based on how long the virus can live. That's just one of the areas where people may be touching the same thing, and we want to get that right for our library workers too. Museums should also fall on that, and we're looking at that right now. We have both private and public museums. Think about the Speed Art Museum in Louisville. Think about the Kentucky Historical Society here in Frankfort. And then they have different things. Some of them have interactive exhibits that you can touch. Well, we can't be doing that. And you know, others don't have those. So wanting to make sure that we get enough guidance from those organizations to get our guidance back to be right. Why are some testing sites not open to everyone, and why are people being charged for the services related to testing when testing is supposed to be free? Okay, so no one should be charged for getting a test. In some instances, I think people are charging a doctor's visit. That should be something that we should be picking up, or insurance should be picking up, that people should not have to have a copay for. But as we move forward, we do need the private sector to start picking up some of this testing, right? There is at least one organization, First Care, that right now can test anybody with no copay to you as an individual, nothing your business is going to have to pay, and it's all done through the private sector. So at some point, you know, the state providing as many of these tests as we have with where we need to get and where we're going to be in the long term, we need more of those First Care models, more of our hospitals that have figured out the way that they can get reimbursed from Medicare, Medicaid, and private insurers. To get to that future, especially when we start having blood tests, that's going to be really important.
You talked about the importance of not having a false sense of security with this virus. I wonder if you are concerned that the government's, the state's own plans for phased reopening, introducing more normalcy into people's lives, could cause that false sense of security.
Yeah, it's a good question. Catherine's asked, I'm worried about a false sense of security out there. I am. I'm worried that summer's here, and will we continue to sacrifice? And I believe the vast majority of Kentuckians will. But the problem with this virus is if just a couple don't, they can spread it to the people who do. And that's the real challenge. It's that we truly need everybody on board, because that one individual can spread it, you know, to 50 or 60 others. And that's why this is truly a test of our unity and a test of how much we care for fellow human beings. Now the question is, am I worried that our reopening plans add to that false sense of security? Yeah, I am a little bit. But I know that where we are economically right now, we've got to try to do this and try to do it safely. I know that Kentuckians have done a heck of a job being healthy at home, and I have trust that they can do healthy at work. But you know, am I worried that going back to the office or going back to wherever it is, creates a sense of normalcy where maybe we forget that this other thing's out there, sure. But I worry about a lot of things every day and about 3 a.m. at night, just about every night. So one of my jobs is going to be to continue to talk about how this is still here, how we are living in it, and how our decisions to reopen certain parts of the economy don't mean that this virus has gone away. Has Kentucky reached out to the Labor Department regarding the state's UI trust fund? When is the fund expected to run out? We are working with the Labor Department on several things related to the UI trust fund. We believe that we are good through the spring and probably into the summer without additional federal assistance directly to the state or UI. We will have to borrow from the federal government, but so will everybody else. Now, right now, I believe that we have the most unemployment claims that have been filed in the country by percentage. Folks, everybody else is going to catch up to us. We encourage people to do it faster. We were more aggressive in opening it up to independent contractors and substitute teachers and anybody and everybody that could have been harmed by this. Now, we haven't helped all those people, and that's our fault, and we're working on it, but we open it up to more people. Other states have taken a slower approach. They're going to reach the same percentages. And at the time when we have major employers going back and we're going back, those numbers are going to change. Now, people talk about the Great Depression and our numbers right now. What made the Great Depression is how long it lasted. The numbers that we're seeing right now aren't going to last for 2 months. Now, are we going to be dealing with the recession going forward? Yes, in some capacity. How bad is it going to be? That depends on the federal government and the stimulus they provide. It will be much worse if they don't provide significant assistance to states and local governments. They did it in the Great Recession, 2008, 2009. They've got to do it now. Otherwise, education, health care, so many areas suffer where we need to be doing more, not less. Okay. Who was next? Yes.
On the 2 minors with this other part of the COVID-19 related illness.
Right.
So what can parents look for, and how do they tell whether this is something they need to take their children to the hospital for?
Well, Dr. Stack is coming up because this is a really important question. It's in this COVID-related illness that's hitting kids. What can parents look for, and what should they do? That is a great question, and we want the expert.
Thank you. So, again, this pediatric inflammatory condition is a new condition. We weren't aware of this before. So what they're reporting is that some of these children can have symptoms where they develop a rash, where they develop a fever that's persistent for multiple days, where they can have signs of weakness, fatigue, muscle aches. They can get runny nose or watery eyes. So it's sort of like if you were to Google Kawasaki's syndrome, it's not exactly the same, but there are enough similarities that they're using that language to describe what it's like. I hope tomorrow or shortly thereafter we'll have some information to be able to announce for additional resources that parents can draw upon, but we're just not ready for that yet today.
Are they testing positive with COVID-19 first and then this comes, or is it this is just the side?
Yeah, so thank you. So a lot of these children are not presenting with respiratory infection symptoms. Some of them may have abdominal pain, or some of them may have more generalized symptoms, but not necessarily the respiratory symptoms that we're seeing in the adults. Quite a few of them apparently are testing negative for the nose test, but they test positive for antibodies, which is one of the oddities about this disease. It appears to cause an inflammation process after you've recovered from the initial infection, but where the body continues to struggle with it. And so one of the things I was doing at the press conference was trying to listen to an update. They were discussing about what they're learning in New York and how that is, how this is continuing to evolve. So we'll report more as we know more with confidence.
But I think it's important to point out because, the science shows it. I don't think it's a question. This is COVID-related, absolutely. And I believe both individuals here in Kentucky have tested positive for COVID. I know the 10-year-old did in the hospital, and the antibodies as well. And that's what they're seeing I think in New York and most of these that they're looking at, when they do the antibody test, it tells you that they've had COVID. So it isn't anything else. It appears to be like other things that we know about, but it is most definitely COVID related. It's still rare. We hope it stays rare. We hope it's not something that's just appeared late and increases. Remember, this is pretty personal to me. First child we learned about is 10, so was my son. And when my son turns 11, my daughter 3 days later will turn 10. So this one's going to stay pretty personal to me.
Is their employment office moving ahead with claims to April, or are there any lagging work that they're still working on?
There are several thousand March unemployment claims left, but they really are the ones that have to go through an adjudicatory process and would always would have had to, unless there is some mistake. I think those now are a much lower rate. So one thing we're doing is we're beefing up our adjudicators, right? It's not just enough to get as many initial claims out of the way as possible, but we got to speed up the adjudications because we have more claims to adjudicate, even if it's the same percentage as before, but more claims have been filed. There is still more work to do. I know the first couple weeks of April are now an absolute priority, and our goal is to get through as many of them as quickly as possible. Phil?
Are indoor shopping malls included in the retail on the 20th? And also
Yeah.
some of the food courts in some of the shopping malls?
So we are working on shopping malls. The indoor part creates a different capacity issue than either freestanding retail or strip mall retail or outlet mall retail. And so we're going to have to work on that, and that's going to require a little bit more. Food courts need to wait till restaurants open because the guidance includes a number of different things that apply directly to them. All right, let me answer one more here. Can I confirm that VP Pence asked governors to test all nursing home residents? We had a pretty robust conversation about nursing homes and long-term care facilities, though this was a conversation I had with him about 3 weeks ago, and we were on the same page about what we were doing, and at the time talked about what we were doing even 3 weeks ago, how important it was and how we were ahead of the curve there. Our plan is a good plan. As opposed to some states, it's already being fully implemented. It brings in private partners. With Norton, it gives multiple lines of communication. It has strike teams that can help go in. We have the National Guard that is helping out at one facility specifically. Listen, none of this is a good situation, none of it. But I feel our response in these facilities is going to get better and better and better. It's going to take time to get through all of them. We committed to do it, but we are going to go by the most vulnerable, the most medically fragile, and we are going to work until we get through all of them. All right, so let's wrap up. I know many of you are tired. I know we seem to have been at this a lot. I know that you probably look up here and it looks the same every day, and it sounds the same every day, but that's part of our challenge. If we're doing things right, to do the same every day. You know, I've got to think about that greatest generation and whether they were overseas, knowing that they had to measure progress by the inches that they moved forward, or whether they were here at home in the greatest generation, retooling our factories and our economy and measuring their output and how much they could help doing the same thing, making the same thing day after day after day, but knowing that doing that same thing and having the perseverance and the strength would help us win in the end. That's what we're faced with here. It is still a very serious adversary. Just because we're doing such a great job early on doesn't mean it's done. So let's continue our work. Let's continue to protect one another. Let's not be the generation that got halfway there and said, ooh, this is tough. Let's be that generation that rose to the occasion, that proved our greatness, that proved our compassion. Remember, we have 10 new Kentuckians we lost tonight, so more green lights than ever. Make sure they and their families know that we are thinking about them. No video to end the night. We'll see you tomorrow at 5. Let's hope for continued plateau or even decline in cases. Let's continue to increase our testing capacity, and let's make sure we're healthy at home, healthy at work, and then healthy at home. We got a long way to go, but every day we're closer to victory. Every day we get closer to the light at the end of the tunnel. We'll get back closer to our old normal, and the amount of time that it will take depends on how well we do this new normal. Thank you all very much.